Good Tuesday evening. Kern County Public Health officials say the current case rate throughout the county has seen a significant decrease in cases compared to 3 weeks ago. But while being optimistic with the new rise of the Omicron variant and the Delta variant still causing hospitalizations, there is still some cause for concern as we approach the holiday season. 23 ABC's Brianna Willis joining us live from East Bakersfield with more on what the county officials are doing to prepare for a potential COVID surge after the holidays. Brianna.
Keely, with only 18 days until Christmas, Public Health is reminding everyone to remain vigilant because as state modeling projects, a fourth COVID surge could be on the way after the holidays.
We have been working with the state to expand hospital bed capacity in Kern in preparation for a potential fourth surge.
While COVID cases have been trending downwards in Kern County, Brent Kerrigan, director of Kern County Public Health, says the Omicron variant is still a concern.
Omicron has been identified in many states throughout the United States, including California. While there are no identified cases of Omicron in Kern County as of now, Omicron is actively circulating in neighboring counties, so it's likely only a matter of time before it's identified here.
And local hospitals are still seeing COVID cases.
Although we are seeing the burden of COVID-19 ease on the hospitals, both the hospitals and the pre-hospital emergency medical services system remain impacted.
According to Kern County Public Health, currently there are 189 staffable hospital beds in Kern County and 36 staffable ICU beds. But after the holidays, that could change.
We continue to review the state's modeling on a weekly basis for planning purposes. The worst case scenario in the state's modeling continues to suggest a significant surge in early February, peaking with 1,279 cases on February 14th and 947 hospitalizations on February 19th.
Kerrigan adds the moderate scenario, however, suggests a smaller surge, peaking at 231 cases on February 17th and 217 hospitalizations on February 24th. And the best scenario?
The best case scenario suggests a slow decrease in disease transmission with hospitalizations bottoming out in May 2022.
But as the county prepares, starting this week, more assistance for COVID-19 will be on the way.
Starting this week, the state has provided staffing for 15 additional ICU beds that will be located at Adventist Health Bakersfield and 15 med-surg beds that will be located at Adventist Health Delano.
Kerrigan adds strike teams are also in Kern to help assist ambulance.
We also have 2 strike teams assisting with ambulance response to 911 calls in Kern. Each strike team consists of 5 ambulances, 10 ambulance crew members, and a supervisor. These teams are slated to remain in place through December 18th, and call volume will be evaluated at that time.
As far as preparation goes for the arrival of the Omicron variant, Kerrigan says mitigation efforts remain the same. Coming up at 6, we'll have more from local organizations about their vaccination efforts. In East Bakersfield, Brianna Willis, 23 ABC News, connecting you.
So where do we stand locally with COVID? Public Health announcing 189 more cases of the virus. 3 deaths also reported overnight. And as of tonight, there are 0 reported cases of the Omicron variant. And we were curious about how Kern County compares to the statewide COVID numbers. So tonight we're taking a deeper dive into those stats. As we mentioned, there were 189 cases today in Kern. Statewide, that number is at nearly 4,000. When it comes to testing positivity rate, Kern is outpacing the state. Currently, California as a whole stands at 2.2%, where our community is at 3.2%. There have been nearly 60 million vaccines administered in the state. More than 960,000 of those were here in Kern, and there are more than 3,600 COVID hospitalizations in the state. 138 are from our community. And when it comes to ICU beds available statewide, there are 1,901. In Kern, there are 20 tonight.